do you have bloating? If you mention it to your doctor, maybe he or she has said, yeah, okay, are you in a lot of pain? And you said, no, I just have this bloat and it's uncomfortable and, makes my jeans tight, something like that. I was listening to a gastroenterologist who's in the functional medicine space, and it was interesting because he made the comment that bloating has become so common that it's become normal. And I always use that expression, common is not normal. And so he made that point, so I wanted to share that because bloating is a very common symptom, but it's definitely not normal. And what does it mean? So when you bloat, what's happening is it's really a sign of early inflammation in your gut. And as time goes on, if you don't get to the root cause of why you're bloated, what's going to happen is that it's going to increase the inflammation along the lining of your intestine. And it's very interesting in our small intestine. There's a single cell layer. So it's this very small layer of cells that line our intestines, and then on the other side is really the body. So we think of our intestines as being outside the body, even though they're not hanging outside. But as far as functionality is concerned, they are from your mouth to your butt. That's outside until the body then communicates. So you have one cell layer thick, and then you have a lot of immune cells right there. So it's like your immune system is kind of tasting what it is you're trying to have enter the body. It's like the immune cells are the gatekeepers, and they're going, okay, you want to pass, you're a parasite. No, I don't think so. And then the immune cells attack it. This is if everything's working the way it should. And the immune cells attack it, and then that's the end of that. And it never gained entrance into your body, into your bloodstream per se. So bloating, hearkening back to that, whether you bloat right away, whether you wake up with your stomach pretty flat, and then as you eat throughout the day, the bloat starts. It is common, but it's not normal, because over time, what this inflammation of the bloating is doing is it's creating a lot of pressure on that lining of the gut. Remember, it's only a single layer. And over time, you get into, maybe you've heard the expression leaky gut. That's where those, they're called tight junctions. And it's really good to think about them as sort of guards guarding a gate. And they're like, who are you? Are you friend or foe? And your friend, and they're like, oh, fine, you may enter. And that's what these tight junctions do. But, if 8,000 people storm the gate, then the poor guards are overwhelmed and, the gates are left wide open. That's really what a leaky gut is. So it's lost that integrity. So when your body loses that integrity, that leaky gut sets you up for chronic disease. So this Dr. Brown, the gastroenterologist, was stating that they're doing retrospective studies on patients with cancer, patients with autoimmune disease. He was very much stressing autoimmune disease, and I completely agree. Cognitive decline, Parkinson's, Alzheimer's, and then retrospectively saying, how has your GI health been, and finding a whole host of problems. It only makes sense. We know that 70% of the immune system is housed in the gut. So of course it makes sense, as that gut breaks down, that your body's going to be less good at defending itself, and that leads to a host of inflammatory diseases. So saying that inflammation is at the root of most of the diseases we're trying to avoid is not an overstatement in any way, shape, or form. But most clinicians don't understand this. Your PCP, your primary care doctor, is not going to make that association for you. So I'm doing it because I want you to know that these things we put up with. I spoke to a brand new patient yesterday, and he was saying, I'm always asking about bowels and bloat and gas and constipation and diarrhea. And he says, yeah, my bowels are better right now. And I'm like, okay, but how were they? And he said, well, I used to go to the bathroom a lot. It was like, it's like fishing and pulling a string. So I was like, okay, what does a lot mean? He goes, I couldn't count. I'm like, you were moving your bowels so many times a day you couldn't count? And he goes, yeah. And I was like, diarrhea? And he goes, yeah. And I was like, for years? And he's like, yeah. So I was extracting this data, but You know, we don't like to talk about our potty habits. We just don't. We don't like to talk to our doctors about it. I mean, I'm constantly extracting it from patients. I precede the conversation with, listen, I'm going to ask you in depth about your bowel movements, so get ready. I need this data. And it's really, really important. So if we're trying to, of course, we're all trying to be healthy and live as long as we want with our active lifestyle, we need to understand this correlation between gut health and overall health. And per Dr. Brown, the most common symptom that's being overlooked, and I absolutely agree, is bloating. So I could go on to say, okay, bloating turns into gas, and very often people are constipated and they don't know it. But for this video, we're focusing on bloat. So assess yourself, see how you do. You probably know if you're bloated because it's uncomfortable and your clothes get tight. That's not something to ignore. So if you need assistance, we are here for you. Please call us for a consultation.